Health insurance is supposed to protect you, but for countless Americans, it's a nightmare. Denied claims, endless red tape, and life-saving care just out of reach. When the system fails, it fails hard. Recently, the fatal shooting of a health insurance CEO in Manhattan reignited public outrage. While we don't condone violence, the stories behind this anger need to be heard. We've gathered real stories from people who've battled the system and lost more than they should have. These accounts show what happens when profits matter more than patients. Here are 5 horrifying health insurance fact stories. 5. Denied for being too proactive. Pregnancy can be a nerve-wracking time, especially after a miscarriage. During her second pregnancy, Jen recognized the familiar symptoms and rushed to her doctor to ensure her baby was safe. The ultrasound confirmed the baby was fine, and her proactive approach was praised by her doctors. But her insurance company didn't see it that way. They labeled the visit unnecessary and slapped her with a massive bill. Considering that about 10 to 20% of known pregnancies end in miscarriage, Jen's caution was understandable. Apparently, catching problems early doesn't sit well with their bottom line. 4. Treatment only if you're hospitalized. With chronic illnesses affecting 6 in 10 Americans, I think most of us can understand that managing a rare autoimmune disorder is already a daily battle. For a BuzzFeed community member known as Milts44, that battle took an infuriating turn when her insurance company became the real challenge. Her monthly IVIG infusions, which were vital for keeping her condition stable, were suddenly denied. The insurer claimed the treatment wasn't medically necessary unless she was hospitalized. Ironically, this meant they were willing to pay more for inpatient care instead of approving her much cheaper outpatient infusions. Even after years of appeals, she's still left fighting for the care she desperately needs. 3. Anesthesia isn't necessary. Motorcycle accidents are some of the deadliest on our roads, often leaving victims with devastating injuries. Sarah's case highlights how insurance can add insult to injury. After severely damaging her femur in a crash, she was placed on a waiting list for a cadaver bone replacement. When a match was found, her surgery became time-sensitive, but a cold turned into pneumonia just before the procedure. Her anesthesiologist adjusted the plan to accommodate her condition safely, but her insurance company decided the anesthesia wasn't medically necessary. Imagine being told anesthesia isn't needed when your knee is being opened and your femur operated on. Her appeal was denied, leaving her with an $11,000 bill. 2. A costly reroute. Nearly 25% of emergency rooms in the U.S. have closed in the last 2 decades, often due to financial pressures and systemic challenges, leaving remaining facilities increasingly overcrowded. For Monica, this meant her in-network ER was packed, forcing an ambulance to reroute her to a rural hospital. Despite having no choice, her insurance company labeled the visit out of network and stuck her with a hefty bill. 1. A whoops worth $15,000. When you pay $800 a month for health insurance, you expect them to cover your medical expenses. When Emily had her first child, labor complications led to 33 hours of labor, an unplanned C-section, and a 5-day NICU stay for her baby. The bills? $66,000 for Emily and $125,000 for her son. Thankfully, her robust insurance plan, with a $750 deductible and $3,500 out-of-pocket maximum, covered everything. Or so she thought. A month later, Emily was hit with a $15,000 bill. Shocked, she called her insurance company, which brushed it off as an error. Emily didn't have to pay, but it makes you wonder how many others out there have paid for these mistakes without questioning them. That's a wrap for today. Follow us for more facts.